I'm John Rutherford, the content editor of Paths to Discovery for Circulation. Today, I'm going to talk to Dr. Melvin Scheinman, who's the Walter Shorenstein Endowed Chair in Cardiology holder at the University of San Francisco, California. Today, we're going to talk about arrhythmia ablation. So, in the 70s, when we had patients with refractory atrial arrhythmias and we couldn't treat them with medications, we were referring them to our colleagues for surgical therapy. And you became interested in the idea of perhaps treating these arrhythmias a different way. Could you tell me how that arose and what happened?
Sure. In the late 70s, we were fortunate enough to obtain NIH funding to perform catheter ablative techniques in a canine model. And I had the wonderful support of people like Dr. Rolando Gonzalez from Chile, who worked with me, and Booker Pullen, who did the electronics. And we came up with a technique of ablating the AV junction using high energy direct shocks. And it had previously been done by Mr. Beasley, and we actually visited him, but I couldn't replicate long-term success until we modified the procedure by using a special catheter to record the His bundle. And then we were ultimately successful in doing this in the animals.
And really a historic event occurred when, I believe, you were referred a patient who had multiple medical problems, including rheumatoid arthritis, had refractory atrial fibrillation, which put him into pulmonary edema, and he wasn't responsive to drugs. And he didn't appear to be a very good surgical candidate either, and I understand he was referred to you, and I'd like you to tell us about this event.
Yes, he was quite a remarkable gentleman. He was an oil refinery worker, and because I had invested so much of my time and effort in this technique, I didn't think it was appropriate for me to obtain informed consent from the patient. So I asked one of my colleagues who knew about our work and was a very honest and direct individual to talk to the patient, and he talked to the patient and family rather extensively. And it was so interesting because the night before the projected procedure, Dr. Hess, who was tasked with getting informed consent, called me up and said, well, maybe you should do more dogs to be sure. And I said, no, we've done 10 dogs and everything worked well, and we sent the dog material off to the pathologist, and they told us that we didn't do any serious collateral damage in terms of damaging the valves or the coronary vessels. And I said, no, either he wants it or not. I'm not going to do any more dogs. So I got there the next morning, and the patient says to me, well, let's get on with it. You know, he was that kind of a chap. And remarkably, we shocked the AV junction, and it turned out to be a lot simpler in man than in dogs. I was telling my colleagues, I don't know why we waited so long. It was much easier. It was much harder to get it in dogs. So that was the first ablation. That was performed in March of 1981.
Right. So things have certainly evolved since then. As you and I know, we really palliated supraventricular arrhythmias for many years, but there's been huge progression in the use of ablative therapy, and I'd like you to just talk a little bit about that evolution.
I'm very happy to, and I'm very proud of being part of this story, and in the sense that I took the first step. So much, as you know and the audience knows, so much of what we do in medicine is palliative. We give pills, but we don't really cure disease. But with the development of electrophysiology and better understanding, first of the paroxysmal supraventricular tachycardias, we were able to apply ablative techniques to where now this is the treatment of choice for patients with paroxysmal supraventricular tachycardia. The big advance was use of radio frequency energy. My contribution was use of high energy DC shocks, but radio frequency allowed us to apply the technique to patients with AV node reentry, with WPW, atrial tachycardias, and it's really a tremendous sense of fulfillment where you have a young person, for example, and the guy's whole life in front of him, and then you could say to him, well, we've done this procedure and you're cured. You don't have to worry about it. You don't have to take pills. And so that's been a great source of satisfaction for me.
So I would like to thank Dr. Scheinman for sharing these really historic thoughts on the treatment of arrhythmias by ablation.